Hi everyone, my name is Dr. Deepashree. I'm an interventional radiologist working at Rela Hospital. Today I wanted to share some information about aortic aneurysm. What is an aneurysm? Aneurysm is a dilated vessel is called as an aneurysm. Now aorta is a major structure which supplies blood to the rest of the body. It supplies blood to every organ in the body. Now when the aorta is aneurysmal, that is when it can cause problems. But the real problem is most of the people with an aortic aneurysm aren't aware that they have an aneurysm. That means it can be silent. So they are asymptomatic. So about 40% of the people with an aortic aneurysm are asymptomatic. Now what is an aneurysm? Whenever there is a dilatation, whenever a blood vessel grows in size, whenever a blood vessel enlarges, we call it an aneurysm. Generally, the size of the aorta is about 2 centimeters. Up to 3 centimeters can be taken as normal, but anything above 3 centimeters is called as an aortic aneurysm. If somebody has an aneurysm, if it is very large, they can become symptomatic. They may have an abdominal pain. If it ruptures, they can have syncopal attack, which is, they can faint and they can have low blood pressure, they can have increased heart rate, and most of the people with a ruptured aneurysm, they actually don't make it to hospital. 80 to 90% is a mortality rate when somebody has got a large aneurysm which ruptures. But if somebody has got an aneurysm which is say around 5 or 5.5 centimeters, they can be asymptomatic, which means they may not have symptoms. But diagnosing these patients early can help in preventing mortality or in preventing the death of these patients. So it is very important that we diagnose an aortic aneurysm very early on by means of an ultrasound abdomen. So as part of a master health checkup, we can have an ultrasound of the abdomen which can diagnose an aortic aneurysm, and if detected early, we can do something about it. Now, there are different types of treatments for aortic aneurysm. One is surgery, the second one is endovascular aneurysm repair. Me being an interventional radiologist, I would like to talk a little bit about endovascular aneurysm repair. Now, endovascular aneurysm repair is a non-surgical treatment for aortic aneurysm. So, this is not a surgical treatment, which means they can come in the morning and they can get discharged within 1 or 2 days. So, it is all that is required here is just like a pinhole procedure. One can get inside the aorta and deploy a stent graft which seals the aneurysm and restores the size of the aorta back to its normal size. This is a very simple procedure that can be done if it is diagnosed early, and that is all the more reason as to one should undergo an ultrasound abdomen to identify the aortic aneurysm. If it is there, then they subsequently undergo CT scans, and finally they can go for an endovascular aneurysm repair, which is an endovascular stent grafting. Somebody was also asking me about the risk factors. Who is at risk of developing the aortic aneurysm? A smoking history, somebody with coronary artery disease, somebody with a family history, somebody with diabetes, somebody with arterial disease in the legs, they are at risk of developing an aortic aneurysm as well. So if there is any of these conditions, if there are any of these risk factors, it is all the more reason as to why one should thoroughly check for an aortic aneurysm. Thank you so much.